All right, so today we are going to continue on with infection control. We are going to be covering standard precautions. So we have talked about this when it did come to medical safety, and we've obviously touched base on it previously when we've covered infection control last week, but just this is going to be a little bit more in depth on the different components of standard precautions. So again, as always, just making sure you guys are taking notes and submitting them by the end of the period. All right, so we talked about hand washing last week. Just a reminder, aseptic means that you are free of germs and it's usually pertaining to your skin. So in a healthcare setting, you are trying to use aseptic techniques on your patients. Even if you think they're not infected, you are just assuming that they could be potentially infectious. And then you're also assuming that maybe you might have something as well. So that's why it's super important to not only wash your hands, but also using PPE, which I know you guys are familiar with because of COVID, but just a reminder, stands for personal protective equipment. And this is relating to your future in healthcare if you choose to do that. You can obviously relate this to coronavirus because we've been talking about that a little bit. But just know that a lot of this is just straightforward. It's intended for when you do plan on working in healthcare. And then it's also just important if you are working in a healthcare setting that you're disinfecting all of your surfaces and equipment. So like for me as an athletic trainer, anytime prior to all of this, anytime a student came in and used a treatment table, I was always, spraying it down with hospital grade disinfectant, wiping it, just because I wasn't worried about COVID at the time. But, in sports, they can have bacterial infections that can be highly contagious. Their sweat is just honestly gross. So I'm just making sure that there's no potential for infection to spread. All right, so PPE. Sure you guys are familiar with glove use. So gloves must be changed after contact with each patient. So when you're removing your gloves, you're trying your best not to contaminate yourself. You are obviously still washing your hands once you remove your gloves, but just in general, you need to be careful when you're using your gloves. I will probably talk to you guys about this maybe in class, but I think it's kind of silly for people to wear gloves out right now if they're like, let's say at the grocery store. And the reason why is I think a lot of people don't realize that once a glove touches something, it's essentially contaminated. So if you're trying to protect yourself, and you're wearing gloves and then you go and touch your phone with your gloves still on, then you're essentially just contaminating your phone. So the second that you take your gloves off, unless you're disinfecting your phone, you're going to get whatever it is that you're trying to prevent yourself from. So gloves should never be reused. They're disposable, which for a reason, and then just making sure that you are aware that when your glove touches something, it is then contaminated. So you're not going to then touch your face, touch a patient, unless obviously you're interacting with that patient and they're the ones that you touch, if that makes any sense. So anytime you wear gloves, or when should you wear gloves? If you're working in a hospital setting, it's anytime you could have potential contact with body fluids, their secretions, and then their excretions. So it could be saliva, it could be vaginal secretions, it could be other reproductive secretions, semen, things like that. You're making sure that you're protecting yourself because you obviously don't want to get whatever they might have. If there's, let's say, like an open sore and maybe it's not blood, but there's pus, pus can obviously contain infectious components to it as well. So again, anytime you have any contact with body fluids or potential contact with them, then you're wearing gloves. And then if you also are cleaning any contaminated items or surfaces, you should be wearing gloves as well. So when we get back into the classroom in a hybrid mode, I will most likely be disinfecting surfaces after, every period. That's my hope. But I will make sure that I'm wearing gloves while I'm doing that, because if I'm cleaning and then I pick up something that maybe was contaminated and I'm not able to wash my hands, then I could potentially, again, become infected. And again, it's not just COVID, it's just anything. And then if you're performing any invasive procedure, so invasive just means something where it's going to go inside. Again, you're going to be exposed to potential blood, body fluids, so you're wearing gloves during that. This says performing venipuncture blood tests. So venipuncture is when you're actually puncturing a vein. And so that's done when you're getting maybe your blood drawn, if you're getting an IV put in, that sort of thing. You're obviously coming into contact with blood, so you're going to make sure that you're wearing gloves because of that as well. This image is just people in not like super heavy PPE, but they definitely are wearing masks. The male, it looks like he might be wearing gloves. The female, not so much. And then they're also wearing gowns. So the gowns will protect you in case anything gets on your clothing. You can just remove the gown and then, yeah, it won't be on your clothing. All right, so gowns should be worn during procedures that may cause splashing or spraying. So yeah, if you're performing surgery, you would be wearing some sort of gown. You're not going to go in there just with your scrubs. It helps to prevent contamination of clothing and your uniform. So if you went into a room, let's talk about COVID again. If you went into a room with a COVID positive patient, you'd be fully donned in PPE. And so donning just means you're dressed in it, or it's placed on you. And so um, because COVID can be spread through droplet contact, so the fact that, maybe somebody is coughing in there or sneezing, if any of those droplets get on your clothing and you're not wearing a gown and you walk outside of the room, you could then maybe brush up against something, come into contact with someone else, and that droplet could then get on that, and then that's continuing that chain of infection. So the gowns kind of just help to break that chain where the droplets could have potentially been on the clothing. And then contaminated gowns must be handled obviously per policy. So depending on the level of PPE, you have different levels. The highest level would be where you're fully dressed. And I can show you guys images of that as well down the road. But somebody typically has to help you get out of that full PPE. And it's just going to depend on the policy, the type of infection, and so forth. And then just making sure that when you're removing your gown, just like when you're removing gloves, you are washing your hands afterwards because, again, that gown could have maybe those infectious droplets and you don't want to, have that on your hands and then potentially touch something and, again, continue that chain of infection. And then this is just an image. Obviously, you guys are well aware of what a surgical mask looks like. This person looks like they're wearing a surgical mask, maybe a face shield as well. But this is going to be a higher level of PPE. So you can see that their gloves are actually tucked. Sometimes they actually tape over the gown sleeves so that there's no way to actually get, whatever infection in there. And sometimes they double glove as well. Again, it's just going to depend on the type of infection. But with the masks, just know that surgical masks are obviously going to be more helpful than like a fabric mask. But the best masks to wear would be like the N95 or even a KN95 would be helpful as well. So again, just masks are worn during procedures that may cause splashing and spraying, so very similar to the use of gowns. The masks and eye protection, so that's why if you ever go into a hospital setting, especially right now, or even a healthcare setting like the dentist, you will see that they're not only wearing, a mask, and it's usually going to be like an N95 mask. They might even have a surgical mask over that, but then you'll also see that they're wearing a face shield. So the face shield is going to 100% block those large droplets because it's like a plastic material. It's not going to be, fabric where you have those porous openings, I guess, if you can imagine that. But it's going to help block, the exposure to those larger droplets that could potentially get in your mouth, your nose, your eyes, and then again continue that chain of infection. So all of this PPE is hoping to stop that infection chain from continuing. And then just know too, in a healthcare setting, masks are usually used only once and then discarded. And so that's where there was all that issue at the beginning of COVID with the healthcare workers, nurses, doctors, respiratory therapists, those that work in hospital settings that had to reuse their masks. And so they were, used to being taught this where, once you use a mask, you discard it because that mask is then contaminated. They weren't able to do that. They were having to reuse it. So for them, they were, obviously worried because they didn't have the proper security, safety measures in place to protect themselves. But I do know, at least from my brother, who's an ICU nurse, that his PPE at his hospital is definitely a lot better. He's not having to reuse the same mask throughout his shift. So that's good. Or like multiple days in a row. But just know that, yeah, protective eyewear and face shields should not only protect, obviously, your eyes, but it should also come all the way down to your chin and also protect some of the sides of your face. So sometimes you too will see healthcare workers wearing like goggles, or they'll even wear just like plastic glasses. And that's just another way to be, more protective or more protected in case you do have the potential to maybe get some type of droplet in your eye. And then sometimes the face shields are not reusable. So if they aren't, you're just making sure that you're disinfecting them after every use. In my training room, I'm only in there a couple days a week right now. But I have started to, wear a KN95 mask. I'm wearing a face shield as well because in my training room, if I'm providing treatment for someone, I'm not going to be able to really have that 6 feet distance. And so I'm just making sure I'm obviously protecting myself. I'm wearing gloves. But with the face shield, it is not disposable. We don't have, unlimited money in our athletic training budget for those. So I just make sure that I disinfect them after every shift with hospital grade disinfectant. And then just know if you are in a hospital setting and you do have to dispose of any, let's say, gowns, things like that, you're always wearing gloves depending on, where you're at. You're just making sure you're following what the hospital or agency's policy is on where you're supposed to dispose of that. And then just remember too, if anything is saturated in blood, it needs to be put in a biohazard bag. And that's just because there is that risk of the bloodborne pathogens, hepatitis B, C, and HIV. So we're not only worried about COVID right now, we're worrying about pretty much anything that could potentially cause infection. And then just remember, so the standard precautions are just developed by the Centers for Disease Control. And so they've been established for years. Obviously, they get, updated as they need to be, but it's just basically you're assuming that every body fluid could have a potential for infection. And so because of that, you're just making sure you're doing what you need to do to prevent yourself from getting infected. And depending on the type of transmission, so if it's airborne versus contact, airborne versus contact, you're going to have different levels of PPE. And then just again, assuming that, all patients must be considered potential source of infection. And then just again, whenever you are using standard precautions, you're using them in situations when you have contact with blood or any body fluid that contains blood. So it could be that maybe somebody has bleeding even in their urine. And that could be due to maybe like a urinary tract infection, something like that. Just because it's urine doesn't mean that you shouldn't also worry about the fact that you could also get a bloodborne pathogen from that. But also, I think if I was dealing with urine, I would be wearing gloves anyways. And then anytime you have body fluids, so saliva, sweat, pus, things like that, anything that's interacting with your mucous membranes, so that would be your mouth, your eyes, your nose, reproductive tract, that sort of thing. If there's any type of cut or opening in the skin, so if the skin is not intact, and then anytime you are dealing with potential like tissue specimens, so specimen is what you would use to analyze something. So if you're taking, let's say, part of someone's skin, you're biopsying it because you think they might have, I don't know, some type of abnormality, maybe cancer, you're obviously wearing gloves as well. And I would say just in a healthcare setting, you just wear gloves the whole time and you're just making sure that you're taking them off between patients and then washing your hands before you put them on and then also after you take them off. But other than that, it's kind of just a little bit of review. So just make sure you get your notes turned in by the end of the period and we will continue on with this chapter tomorrow, and have a good day.